This Saturday is World Movement Disorders Awareness Day, raising awareness for disorders that are often difficult to diagnose, treat, and understand.
At UI Health, neurologists and neurosurgeons work together to overcome these historical misconceptions through advancing research, innovative surgical treatments, and coordinated care. Dr. Afshari and Dr. Pucci join us with more. Welcome to you both.
Thank you.
Okay, and Dr. Pucci, we'll talk to you in just a moment. But Dr. Afshari, tell us first, tell us a little bit more about movement disorders.
Yeah.
What does that all encompass?
Absolutely. So movement disorders, for the most part, are conditions that stem from dysfunction at the level of the brain. So most of these patients are taken care of by neurologists like myself, neurosurgeons. Usually with movement disorders, they're classified into disorders where there's too much movement in the body, essentially. For instance, with hand tremors, that's one of the most common movement disorders. Or there's too little movement in the body, again, stemming from dysfunction from the brain. One of the most common movement disorders where there's too little movement is Parkinson's disease. And in Parkinson's disease, you have slowed movements, patients look a little bit more frozen, and that can also manifest in their walking and their balance.
So how would this be diagnosed? Is this something where I feel like there's such a wide range that it would be, as we mentioned, hard to diagnose?
Absolutely. It's a little bit hard to diagnose. These conditions don't happen overnight. The symptoms generally are taking place over the course of years, and usually patients will come with symptoms to their primary care doctor and hopefully will be referred to a neurologist. And ideally, the neurologist will refer them to a subspecialist like myself because there's so many different treatments that are out there. There's really a lot of hope and a lot of great therapies out there for these patients.
Yeah, can you talk about some of those therapies? How is this treated?
Yeah, there's really tons of medications out there for movement disorders. For instance, in Parkinson's disease, we know that the issue is due to a dopamine deficiency in the brain. And so we've been able to figure out how to give dopamine back to patients, either through a pill, even through continuous pumps. And then we also have come up with even more advanced and somewhat invasive therapies. That's where Dr. Pucci comes in. That these therapies can really relieve patients' symptoms of movement disorders, treat their symptoms, not cure the condition, but really treat their symptoms of movement disorders so they can have a high quality of life.
And one of those we're talking about here, deep brain stimulation. Dr. Pucci, what does that mean?
So deep brain stimulation, it's a minimally invasive surgery where we place very thin 1 millimeter electrodes into specific regions of the brain. It can be used to treat a number of different conditions, but most commonly movement disorders like Parkinson's disease, essential tremor, dystonia, also the movement tics associated with Tourette, some specific cases of OCD and epilepsy. But basically, the neurons in the brain communicate with each other through electrical signals. So in deep brain stimulation, we're essentially speaking that language to the brain in order to deliver specific patterns of electrical stimulation. And in that way, without doing a surgery where we burn or ablate or lesion tissue, without any of that, we can change the way the brain functions. And we can disrupt abnormal communication in the brain, for example, in the case of Parkinson's disease or other movement disorders like that. So from a practical perspective, somebody with Parkinson's disease, for example, it can really reduce the motor symptoms, the tremor, the rigidity, the bradykinesia, and kind of turn back the clock to an earlier stage of the disease where it was easier to control on medication, and it can really be used as an adjunct to medication, so we can go down on medication in a lot of patients with Parkinson's disease too.
That seems so cutting edge. So that means it can actually reduce tremors.
Yes, so the basic technology has been around since the 90s, but there have been incremental improvements. Now we can detect the brain activity in real time, so it sort of functions like a little computer and might change the stimulation pattern depending on the patient's individual symptoms. So we keep building on this technology as newer technologies emerge.
And I'm sure if anyone's watching who has questions about this, they can visit you guys for comprehensive care with both of you.
Absolutely. We work together. We're a team. We evaluate patients for these advanced therapies together. We meet monthly to discuss more nuanced cases, and we really want to make sure that we're providing this therapy to people who are good candidates, to all patients who are good candidates, and making sure that the therapy is really going to have the outcome that we're looking for.
Great. Thank you so much for being here.
Thank you both very much.
Absolutely.
We appreciate it.
For more information, you can scan that QR code right there on your screen. You can also head to uihealth.care and find them on the socials.